So this is going to be my IV discontinuation. It's Chelsea Sandberg. I will go ahead and just make sure I check my orders that the IV is going to be discontinued and there's nothing kind of outstanding that would suggest, maybe we shouldn't remove it. Like, a medication scheduled to the IV that hadn't been given. I would just kind of verify those things first. And then I would go ahead and walk in, introduce myself again. Hi, Miss Carly, it's Chelsea. I'm back. It looks like we are all finished and we need to go ahead and take that IV out of your arm, okay? Okay. All right, so what I want to go ahead and do first is just verify your name and date of birth. Carly Escobar, 31XX. Perfect, that matches my orders. Do you have any allergies? No. All right, so I'm going to go ahead and I'm going to use some sanitizer, put some clean gloves on, and I'm going to get that out, okay? Have you had any pain or anything since I inserted it? No? Okay, perfect. And I do note visually this site does look clear. There's no redness or swelling. Okay. All right, so I'm going to go ahead and use some sanitation. I'm going to don some clean gloves. I'm going to make sure I turn off the IV pump and use the roller clamp. I would do that. Unhook the IV. Just make sure this is clamped. Okay, all right. So I'm going to go ahead and I'm going to have a 2x2 nearby. And I'm going to go ahead and just start taking off the tape really quick. Just going to make sure I'm keeping everything stable. Just going to save, side note, saving the IV label. All right, so then once I've got the sides, I'd probably use like a little bit of alcohol or something to kind of roll this around if I had some. Keeping the HUD stable. I'm going to remove that. Okay. I'm going to go ahead and keep my 2x2 close by. I'm going to pull out the catheter, apply pressure, and I would inspect the catheter and make sure that there are no flaws, all the bits intact. And then this would go straight into the sharps container. Okay, now that I'm going to be holding pressure on this for 2 to 3 minutes, I'd go ahead and tape this. Oops, pardon me. Okay, and I would just notify the patient that if they had any pain, swelling, discharge, to notify us. And then I would document the procedure with the date, time, the IV was removed, as well as the patient's tolerance, and also that I removed it. Okay, and take off my gloves, clean, and this would stay on, but of course it's me, so it popped off, but that would be the process.